Hi, my name is Shabonda Jackson. I am a BSN nursing student at Indiana State University, and I will be doing a presentation today on COVID-19. What do we know now? Population at risk includes all males and females. New data have shown that ages from infancy until 65 years old are at risk for contracting COVID. At the conclusion of this presentation, the participants will be able to define and explain coronavirus, also known as COVID-19. Define and explain the modes of transmission of COVID, identify the treatments available for COVID, identify testing that is used for diagnosing COVID, identify the prevention methods available to protect against the spread of COVID. Before continuing with the presentation, please complete the pre-test, and there will be a post-test at the end of this presentation. Thank you. COVID-19, coronavirus pandemic. Novel coronavirus SARS-CoV-2, also known as COVID-19. COVID attacks the respiratory tract, resulting in acute respiratory distress. This virus originated in Wuhan, China in 2019. COVID-19 has impacted the country worldwide, physically, emotionally, financially, and mentally. The incubation period for COVID-19 is usually 5 days after virus exposure. A 14-day quarantine is recommended after exposure. Delayed treatment can lead to death if the symptoms persist and no medical treatment is sought. According to Johns Hopkins and the CDC, COVID statistics worldwide, over 127 million confirmed cases of COVID, 2.78 million confirmed deaths. In the United States, over 30 million confirmed cases of COVID and over 546,000 deaths have been recorded. Vaccinations, 140 million have been administered. Modes of transmission. Transmission. Human ingested of an infected animal that may be the host or carrier of the coronavirus. Humans transmission through respiratory droplets by coughing, sneezing, talking within proximity less than 6 feet, touching contaminated surfaces, being in crowded areas with no room for distancing. The incubation period be 5 days from the time of exposure. The recommended quarantine period is 10 to 14 days. Some cases may require longer times depending on the symptoms. Carriers may be symptomatic or asymptomatic and still be able to transmit the virus. Symptoms of COVID may include fever, fatigue, muscle aches, diarrhea, shortness of breath, headache, loss of taste and smell. These places or gatherings that may have crowded places would be churches, community centers, stores where you shop at. All these places will have been practicing social distancing and masks required to prevent further spread of the virus. Protect yourself and protect others. We can do this by wearing a mask, hand washing, sanitizing, social distancing, and making sure we're staying 6 feet apart. It's also important to avoid large gatherings. Testing for diagnosis of positive tests of COVID-19 include antibody tests, which is blood sample to test for positive antibodies, antigen tests, PCR test, which is the nasal swab, which results 24 to 48 hours after being swabbed, the rapid testing, which can be done 15 to 30 minutes after the swab. Saliva test can also be done. A chest x-ray can be done to detect signs of scarring and different things like that may be signs of COVID or pneumonia resulting from COVID. Levels of severity. Mild upper respiratory tract viral infection. Symptoms include fever, dry cough, sore throat, fatigue, malaise, headache, muscle pain, loss of taste and smell, diarrhea, nausea, vomiting. Moderate pneumonia that results from COVID may include cough, shortness of breath, rapid breathing in children and adults. Severe pneumonia includes dyspnea, hypoxia, cyanosis, and coughing. Acute respiratory distress may require ventilation from respiratory failure, sepsis, or even septic shock. Types of treatment. Convalescent plasma is used from donors who have survived COVID and have developed antibodies that will assist in the decreasing of symptoms in patients actively suffering with COVID. Remdesivir studies have shown a decrease in recovery time for patients actively suffering with COVID. There are 3 vaccines that are available right now in the United States, and we will discuss each of them. The first one is Pfizer. This vaccine is a 2-shot vaccine to be given 21 days apart. Does not include any eggs, preservatives, or latex. Side effects patient may experience at the injection site are pain, redness, swelling. Patient may also experience these side effects after receiving the vaccine is tiredness, headaches, muscle pain, chills, fever, and nausea. The second vaccine is Moderna. It is a 2-shot vaccination. The vaccines may be given 28 days apart. It also does not include eggs, preservatives, or latex. The side effects that the patient may experience at the injection site are the same as the Pfizer. They may have pain, redness, or swelling. The potential side effects after the injection is tiredness, headaches, muscle pain, chills, fever, and nausea. And the last vaccine is the Janssen vaccine. It's made by Johnson & Johnson. It's 1 shot that will be given, and it does not include any eggs, preservatives, or latex. It has the same side effects at the injection sites: pain, redness, and swelling. And symptoms after the injection may include tiredness, headache, muscle pain, chills, fever, and nausea. That is the conclusion of my presentations. References are listed below. There is a pre-test to follow this. If you can please take that, I would appreciate it. And I hope the new information given has helped you understand where we are with COVID. And as we continue, that we will Try to stay protected and COVID free. Thank you.